And welcome to this community briefing on COVID-19. Joining me once again today is interpreter Margie Prop, and thank you, Margie, for being here to provide your services. To access information and resources available to support our community throughout this pandemic, we encourage everyone to visit our website at covid19.lincoln.ne.gov. There you'll find a dashboard with the latest data and information about our community's statistics, and we update those statistics daily at about this time. At that website, you'll also find our COVID-19 Risk Dial, a color-coded tool that gives our residents an understanding of the risk level of transmission of the virus here in Lincoln and Lancaster County. We update the dial every Friday, and this week we move from the low orange section of the dial to the high yellow section of the dial, indicating a moderate risk of the spread of this virus in our community. This is the first time that we have been in the yellow section of the dial since July 2nd. Thank you to everybody in Lincoln and Lancaster County who have made this important step forward possible. What we know from the experience we've had in this pandemic is that this kind of progress is hard won by our collective commitment to proven public health practices. When we practice those 3 W's, when we wear our masks and wash our hands and watch our distance, keeping 6 feet from others, we begin to exert more power over this virus and more control over our lives. What we also know now from experience in this pandemic is that this power and control that we crave is as easy to lose as it is hard to win. That's what makes this fight so hard, so frustrating, and so exhausting for everybody. Still, we know that we can get through to the other side of this pandemic, and we can get through to the other side faster if we remain faithful to wearing masks and washing our hands and watching our distance. Our victory in this fight against COVID-19 continues to come down to the choices that we make. These choices either propel us forward or pull us back. Our case numbers from yesterday and today demonstrate why we must continue to make good choices and why we must not let down our guard, even as we move into yellow on the dial. Our move into yellow is based on the trends of our cumulative data for the past 3 weeks. And while we are pleased with our progress over the past 3 weeks, our case numbers from yesterday and today should rally all of us to double down on the proven precautionary public health practices that we know can keep our family, our friends, and our neighbors safe. Today, an additional 38 individuals in Lincoln and Lancaster County have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 3,591. Our total recoveries identified to date is up from 1,641 to 1,697. Health Director Pat Lopez is here to provide more information and an analysis of the main indicators that we use to determine the position of the risk dial. Over to you, Pat.
Thank you, Mayor. The move to the yellow category indicates that we now have demonstrated reduction in the transmission of the virus and a controlled level of COVID-19 in Lancaster County. We all need to remain vigilant, but we can resume more activities while wearing face masks and keeping at least 6 feet apart from others. When reviewing the past 3 weeks of data, we see that all 5 primary factors the health department uses to communicate the risk to the public has shown some improvement. The number of weekly cases has been decreasing for 3 straight weeks now, from 360 the week ending July 25th down to 155 the week ending August 15th. That's a 57% decline in weekly cases. So far this week, we have a total of 136 new cases. The 7-day rolling average also shows a steady decline from an average of 44 cases on August 1st down to an average of 17 cases daily through August 19th of this week. This is the first time we have seen daily case averages in the teens since July 2nd. We have also seen a downward trend in the number of cases per month. We have 1,317 cases reported in the month of July. In the first 20 days of August, we have had 458 cases. The weekly positivity rate has also dropped from 3 consecutive weeks, from 8.3% the week ending July 25th down to 5.6% ending August 15th. So far this week, we are at close to 6%. Testing remains widely available in the community. However, we have seen a decline in the weekly testing this month from about 4,300 tests the week ending August 1st down to just over 2,800 tests the week ending August 15th, a decrease of nearly 35%. So far this week, just over 2,200 people have been tested. We believe one reason for the decline in testing is the increased use of face coverings. When we do contact tracing, we are identifying fewer people as close contacts because they have been wearing masks. That means fewer people are considered high-risk exposures that should be tested. We do expect testing to increase now that schools and colleges are back in session. UNL is doing testing on campus, and there are plans to have tests in Nebraska on other campuses as well, such as Wesleyan has initiated testing. Other local colleges also are planning to expand testing for their students. We are pleased to see improvement in the overall turnaround time to receive test results from the labs. While we have no control over the indicator, a quick turnaround is very important so we can begin our follow-up for those who have tested positive. Over the past 3 weeks, 81% of all testing results were received within 3 days or less. Ideally, we would like to see all test results returned within 24 hours. With the average of daily cases declining, the caseload for the nurses doing investigations has decreased. This has helped us to initiate contact tracing even sooner. Over the past 3 weeks, 94% of all positive test investigations were completed within 24 hours. Lincoln's hospital's capacity is another thing that we look at, and that remains healthy. The number of COVID patients have been trending down from 22 on August 4th to 14 patients reported today, with 4 from Lancaster County and 10 from other communities. However, the overall hospital census and ICU bed use has been increasing recently. ICU bed capacity has dipped just over 50%, which has not happened since late May. On Fridays, we have been sharing the gradient map that averages the 3 weeks of data and metrics. Again, if you draw a diagonal line from the upper left-hand corner straight to the bottom right-hand corner, this divides the upper section of orange and red, indicating high and severe risk, and the lower section of yellow and green, indicating moderate and low risk. Toward the bottom left, you will see that testing availability and contact tracing are near green. Towards the middle, you will find nearly all the other metrics clustered near the edge of yellow and orange. That includes the weekly positivity rate, new cases, average testing turnaround time, connected cases, average daily hospitalizations, and community spread. The location of the risk dial is represented by the blue square outlined in red at the middle of the gradient map in the upper yellow section. We are moving into yellow cautiously, and we want everyone to understand that our progress can be lost if we let down our guard. We must not lose sight of the end goal to move past this pandemic. To do that, we must continue with physical distancing, wearing face masks around others, and washing our hands. More and more evidence continues to be published about supporting these recommendations. With college students back in town, we continue to be concerned about those restaurants, bars, and other businesses where students are likely to gather in indoor spaces. You'll recall that after Lancaster County eased some restrictions June 22nd, we began to see increase in cases in the 21 to 29 age group. With more education and enforcement, the percentage of cases in this age group did drop, and so far this week, about 26% of the new cases are in the 20 to 29 age group. The Health Department did host a Zoom meeting with Downtown Bars this week in our ongoing effort to share information and increase communication. A highlight of the call was having bar owners and operators share with each other the strategies they have found to be most effective in ensuring people follow the recommendations. We also worked directly with several bars to provide more specific guidance on practices to maintain compliance with the directed health measure. The Health Department and Lincoln Police Department will continue to do compliance checks at bars. All those in Lincoln who are following this simple common sense guidelines deserve a big thank you for getting us back into the yellow level on the risk dial. Let's stay vigilant and stay safe.
Thank you, Director Lopez, and to everyone at our health team. One of the most important partnerships that we have in our community is our city government's partnership with our Lincoln Public School system. These strong ties have proven invaluable during this pandemic. Our health department has worked closely with LPS on our shared priority of keeping children and adults safe as they reenter our schools. At this time, Superintendent Dr. Steve Joel is with us again to update us on how the first week and a half of the school year is going and the steps moving forward. Dr. Joel, thank you to you and your team at LPS for your leadership in these extraordinary times.
Thank you, Mayor. Appreciate the opportunity very much, and certainly appreciate your leadership. Clear that the mandates and the practices that we put in place have made a difference, and from a school perspective, we need to continue that work because we would like nothing more than to get all of our students back into school and all of our activities, not having to worry about whether or not they're going to be able to complete their season, and we certainly hope they'll be able to do that. And I also would be remiss if I didn't call out Director Lopez and your fantastic team of health professionals for all the help and support and guidance you've given us as we've developed our plans. Our plans are good. We've got a week of remote learning under our belt, and certainly I think that's been a major challenge in some ways, but a lot of rewards as well. I believe our schools are safe. I believe that our schools are not without risk, but with mitigated risk. And certainly we've been hearing from parents, almost 120 of them this week, that are coming back into our schools from remote learning because of what they've heard. So we see that all as positive. We also see the fact that we're doing our very, very best in all of 60 of our schools to follow guidelines that hopefully we're a big part of the risk dial coming down into the yellow, and we'd love nothing more than get to that lower end of the yellow and then hopefully to green, and then in Director Lopez's words, at the end of the pandemic, which we all are welcoming when that day comes. A lot of questions we've received. If we go yellow, are we bringing our high school students back to 100%? We've received several emails and phone calls about that today, and I would say right now, no, we're not. We're going to maintain our course. One risk dial adjustment in the right direction is not a trend for us, and we don't want to be disruptive to our families and to our staff that are working so hard right now to produce curriculum through remote as well as in person. So we're going to continue to review. I think it's in all of our best interest to maintain our course until such time that we're convinced that we're in a different trend. So we don't want our families to feel like they're experiencing a yo-yo effect. We don't want our students to feel that. And certainly, I want to take this opportunity to thank our teachers for all the fantastic work that they've done this week. And it hasn't been easy. It certainly represented dramatic change in their professional lives, but I do believe they've responded accordingly, and we're on the right track. So we know the university's returning. We know the traditional flu season's coming. We know that we still have a whole bunch of challenges in front of us, but I do believe that LPS is going to continue to do our part to continue to move that risk dial down. And again, I appreciate the time very much. Thank you.
Thank you, Dr. Joel. While school administrators and staff have done a tremendous job, it's really important to understand and acknowledge that the activities and interactions that the students and teachers and staff engage in outside of the school setting will impact how successful in-person sessions will be. Let's recognize just how important it is for them and for all of us to continue to wear masks and wash our hands and watch our distance, keeping 6 feet from others, as we engage in everyday activities so that we can help prevent potential exposures that could then be brought into the school setting. And when there is a confirmed positive case of COVID-19 in a school, the school will work with our health department team in the contact tracing process. Anyone identified as a close, high-risk contact will be called directly and given instructions on next steps. Those next steps could include self-monitoring or quarantining and reporting to the health department or healthcare provider if symptoms develop. If there is a positive case reported at a school and a person is not directly called by the health department or a school staff person, then they are not considered a close, high-risk contact. Anyone with questions about possible exposure should contact their healthcare provider or our health department at 402-441-8006. Next up, we have some good news from the Lincoln Littles program, which is increasing access to quality care and education to make sure our children are ready for school and a life of learning. Lincoln Littles grew out of the Prosper Lincoln effort, and Ann Brandt with Prosper Lincoln is joining us now by Zoom to share information about job openings, childcare openings, and the availability of assistance from the CARES Act. Over to you, Ann.
Okay, thank you, Mayor. Good afternoon. Lincoln Littles supports families, early childhood providers, teachers, businesses, and our community. Many Lincoln child care providers are in need of employees, both full and part-time. There are currently 42 job openings at 14 different programs, 13 of which are full-time and 29 part-time. These job openings can be found by going to the Lincoln Littles Facebook page and clicking on the Jobs tab. Please contact the employees listed directly for more information. Also, the minimum requirements for applicants are you need to be at least 18 years old, have a high school diploma or GED, and pass a background check. Some programs require specific educational degrees depending on the position. We also would like to make families aware of openings we have for childcare in our participating Lincoln Littles tuition assistance programs. Families seeking financial assistance to help cover childcare costs and also meet the income requirements are encouraged to contact one of the 20 programs around town. Currently, there are 38 partial scholarships and 29 full scholarships. Openings can be found at lincolnlittles.org under the Providers tab or on the Lincoln Littles Facebook page. Finally, we want to remind childcare employees and family home providers that $100,000 of the CARES Act money has been set aside specifically for childcare employees to help cover costs of mortgage, rent, and utilities due to reduced income during the pandemic. You will find more information at covid19.lincoln.ne.gov at the Resident Resources tab. And for any of that information, if anyone has questions, you can contact, our contact information is on our website at lincolnlittles.org.
Thank you, Ann, and thank you for all you do to ensure our littlest Lincolnites get a great start in life. And we appreciate knowing about these job opportunities and the financial assistance that's available for people as they're seeking care for their children. And finally, today, we want to just highlight that the U.S. Census is getting ready to wrap up, and it is extremely important that everyone gets counted. The good news for our community is that Lincoln is #1 in the self-response rate for cities with populations above 250,000 and up to 1 million. We top the nation with a 75.8% response rate. Nebraska ranks 4th in the state list at 69.6%. And census workers have started going door to door to get information from households that have not yet responded. You can save them a trip by responding online. Just go to 2020census.gov. County Board Chair Sean Flowerday and I recently recorded a PSA to remind people how important the census is for our city, our state, and our nation. Let's take a look. The 2020 census is currently underway. The census is used to determine how many federal dollars come back to our community for important programs like streets, healthcare, and school lunches.
For each person not counted, our community loses over $13,000 in federal funding over 10 years. there's still time to complete your 2020 census. Do you know who counts?
I count.
I am from Chicago and I count here in Lincoln.
Phải, đúng,
I count.
أنا أتحسب.
我有改变的能力。
I count.
We all count.
Census takers are now visiting households that have not responded to the 2020 census. Avoid the knock on your door by responding today.
And just a reminder that all information you share with the census is confidential, and just please make sure that you are counted too. And with that, we'll open up the press briefing for questions from the media.
Hi, Mayor. This is Bill with 1011. I know the mask mandate right now is set to expire in 10 days. Has there been any thought given to extension or letting it expire?
You know, you're likely to see that continue, Bill. We want to continue to have these proven public health strategies in place. And right now, as I've said in previous briefings, we're sort of at a crossroads. We've got schools reopening. We've got university students and college students coming back to their campuses. We don't know what the next few weeks could hold for our community in terms of our case counts and our positivity rate. So it's best to be conservative and to continue to adhere to something we know helps keep our friends, our family, and our neighbors safe. But we'll have more details and more affirmative information about the next round of DHM measures in the coming weeks.
Mayor Riley with the Journal Star.
Hi, Riley.
Just following up on that, you know, is there a metric that you'll be keying in on to determine whether or not the mask mandate should continue? Understanding that essentially with college back in session, Lincoln has a bigger population than it did in the summer when there wasn't a mandate. Are there certain aspects or factors that become more important because we have a larger population?
You know, I think that until we have a clearer picture that we're coming out to the end of this pandemic, masks are going to continue to be an important strategy that we're utilizing. So we can get back to you with more information in the coming weeks on that. But, you know, it is hard to hear that, I'm sure. We all want to get to a time when we are not having to wear masks or aren't as worried about what we could come into contact with, knowing there's a novel virus in our midst. We will get through this. We will get to the other side of the pandemic, and I want to say that we will get there faster as long as more of us continue to wear our masks and wash our hands and watch our distance. That's how we come to the time when we can clearly say that we're free to move about in ways that are more familiar to our daily lives. Other questions?
Hi, Mayor. This is Jeff Robb with the World Herald. I have a question for either you or Pat Lopez.
Sure.
My question is about the last 2 days of cases that were higher for the city. What is at play there?
I'll let Director Lopez speak to that. I think at this point, those investigations, the contact tracing on those cases is underway, so we should have more information next week.
As the mayor said, we're still investigating from yesterday and then our cases today that we just received. So we'll know more about connections and community spread early next week. But I do want to share that, you know, even though we've had that influx in the last 2 days, our total case number are only up by 2 from the same time last week. And we're analyzing what's happening, if it's having more people in the community and where we're at. So we'll be able to give you a better idea after we complete the investigations.
Pat, one other question about that. Are you getting any numbers in from the University of Nebraska-Lincoln testing yet?
Yes, we do get numbers in. We just are doing a data fix so that we can get those reports in very clearly from all the Test Nebraska sites. The university is using Test Nebraska, and Nebraska Wesleyan is also using it in Lincoln. And I know that they both will be reporting out from their facilities. We're working with the university on a dashboard for them to present and share with the student population. So you'll be hearing from them as well.
Well, let me just ask, how many cases have you seen from the University of Nebraska-Lincoln?
You know, I don't have any confirmation of those numbers just yet. We know that there are probably a couple of cases, but we're just right in the middle of investigating, Jeff, so I want to answer you, but I don't have the correct information to give you, and that's one of the things we're really keen on here is making sure we're accurate.
Director Lopez Riley at the Journal-Star. After your conversation with bar owners and your staff's conversation with bar owners yesterday, what message and kind of who's relaying the message on sort of safe behavior and interaction at bars to the university students who, you know, have now kind of entering one of their first weekends of full school?
You know, there have been articles in the Daily Nebraskan. There's information provided in all the orientation materials for the university. They have information on their website. The president and the chancellor have both been providing the same messaging. We are in contact with the university at least once, if not twice a week, and we're also working with them on messaging that's going out through a campaign that we have. So we're trying to do everything we can to have the students realize what their responsibilities are. And we have many people coming into our community that haven't been experiencing the same type of outbreak we've had here, or even maybe more severe in some other states. So just giving them the messaging about what the expectations are here. And I think you can see, especially with the university, having a week of remote learning is part of the process that they're using.
Pat, you'd mentioned the 25% of the cases so far this week, I think if I heard you right, were in that 20 to 29 age group.
Yeah.
Is that correct?
Yes.
Is there a baseline for health departments like ours to sort of weigh the new case numbers that they see on a daily basis versus kind of that change in demographic or citywide? You know, obviously more people in a city, there's going to be potentially more cases if people are being tested. And do you guys kind of have a metrics that you're going to be weighing these daily numbers against now to see whether or not there's increased spread, or does the infection rate tell you that, the positivity rate, or can you speak more on that?
The positivity rate is what we look at in a great deal based on the number of total tests taken. But we also look at across the age span. We're looking across, it's several things that we look at. We look at what the age groupings are, where the new cases are on a week-to-week basis or a day-to-day basis. We also look at where, if we have any outbreak situations, or if it's just generalized community spread, or it takes a multitude of factors. We're asking people, were you at a bar? Were you at a wedding? Were you at a family gathering? So we're collecting all that information, and that's what we share with you when we're talking about where we're knowing that people have been, where outbreaks have occurred.
And have there been any new outbreaks?
No new outbreaks. One of our colleagues had an outbreak and they were able to trace it back to members that were on a party bus, so that was an opportunity for education, but we haven't had that similar situation here right now, other than really identifying when we started giving the messaging about the bars in one specific age group.
And if there aren't any new outbreaks, are there existing outbreaks on any of the college campuses?
No, not yet. And we're hoping to keep that from happening. That's our plan. But we're prepared.
Pat, how do you define an outbreak?
Well, it's a number of cases. You can have a cluster of cases between 2 to 5. Then when we move beyond that and all the individuals are in the same place, let's just say we start talking, we have positive cases, we start interviewing them and doing contact tracing, and they say, oh, I was at this birthday party at this place. Then we start working with the individuals there, and we can put out information, talk about a time when the party was, if they don't know who was all there, and we'd follow up from that way.
So more than 5 cases from one place would be an outbreak,
Yes.
right?
Mhm.
Okay.
Yes.
Thanks.
Mhm.
So let me just ask this, Pat, I'm sorry.
No, that's all right.
To be clear, so you have no outbreaks thus far on any of the university or college campuses?
Not that we're aware of right at this moment, you know. Anything can change, as you've all heard, in a short period of time. But that's why we're closely monitoring. We have communication, it's two-way communication between the colleges and the health department, and the health department and the colleges.
Director Lopez, just a risk dial question. Are there any other sort of changes in the community if the dial goes to yellow? I know school districts were sort of pegging some of their protocol and to that, but are there any other changes that come with returning to yellow for Lincoln and Lancaster County?
You know, we're still encouraging people to be cautious when they leave the home, but people are able to leave the home and follow safety procedures using their masks, the similar things as in orange, but just a little bit more activity is there. And talking about some of the things that they can do in the home and with other groups and interactions, Riley. So basically, you know, still very cautious, but a relaxation of a little bit more of the same guidance.
Any other questions? All right, well, thank you so much for joining us today. We appreciate the work that all of you in Lincoln and Lancaster County are doing to keep yourself safe, to keep your family and friends and your neighbors safe. Have a great weekend, and we'll see you next week.